We will start first with Maurice Mulisa from HISP Rwanda. I hope I pronounced your name correctly.
That's correct.
Yeah. The stage is yours.
Right.
We look forward to your presentation.
Thank you so much. Good morning, everyone. My name is Maurice, Head of Software Engineering at HISP Rwanda, and I'm glad to be the first speaker today. And I just would like to jump right in. So today I'll be presenting about the improving immunization coverage in Central Africa Republic, the Region 5. So as you can see on the map, we have those three districts. They're the districts from Region 5. And I'll be talking especially about the digital microplanning, how we integrated in DHIS2 for data-driven, equitable micro vaccination planning. Before I begin, actually, I would like to give special thanks to Dr. Placide Roch Bisenge, Director of Extended Immunization Program. He is the actually main contributor to this presentation. There's an abstract. If you go to the conference details, you'll see it. And also special thanks to Dr. Jawi Hamza, my colleague, the host who is in the audience, myself, Mutali, Bosco, and Daniel. All right, thank you. So what's the core message here? So our core message today is that a DHIS2 integrated microplanning, the solution transformed the fragmented data into centralized monitorable system. So how did that happen? Here we have, we were able to achieve 100%, we'll see details later, 100% microplans centralized, 73 interactive maps produced, and we were able to train 36 healthcare staff. And also we achieved more than 50 points of penta coverage change. So this matters because in fragile settings, microplanning quality determines whether the teams can identify unseen, underseen communities, plan outreach session, and monitor execution. So what's the context here? So we're talking about the Central Africa Republic, where the immunization coverage for Penta 3 was at 41%. And actually, the zero-dose children, they were estimated at 37. That was a big problem we found there. So they were also planning bottlenecks where manual microplans, they were being done in fragmented Excel sheets. Actually, they had manual maps. They had to draw on maps with markers, and they had weak centralized data and quality constraints. And actually, sometimes it worked for them, but it was really challenging. So when we arrived there, so we had to learn what they are doing, how it's helping them, and then we digitized what they had already. So what changed? Microplans became a DHIS2 data product. As I said before, they had a lot of Excel files where they were trying to keep track of everything. And maps, the handwritten maps, sometimes they were losing them. Sometimes the country is full of rivers and mud roads. And when they are traveling, they are losing maps. They get like everything was not centralized. What we did with DHIS2, we built a tracker where everything is done now, and they can do everything in the DHIS2 tracker. On top of that, we built a DHIS2 web application that brings everything together. And actually, on top of that, we can generate for them DHIS2 reports, the maps. They can print them, go with them to the villages, and do their plannings. So we'll be also seeing how this is how implemented the approach we used. As I said, we analyzed what they had already. So because they had something working for them, that's something we should not forget. but it was not efficient. So we had to assess what they had and the limitation they had. So on top of that, we built a solution, which was DHIS2, the tracker, plus the microplanning app. And we used WorldPop, thanks to WorldPop. Is there any WorldPop person from me? All right, I think they will follow later. So we used WorldPop data to enrich the outputs. Actually, what we did is we create the maps, and on top of the maps, like population data, we add the layer of WorldPop data to make sure even if there is missing data, we can always see where the people live. We'll see in the next slides what we're able to achieve. And we trained people to enable them and look in terms of capacity and include actually, we realized there was a gap in the people who were using the tools, and we tried to include the women to make sure we remove the gender barriers. So this is a diagram. I think most people can see if I go through it. It's going to take time, but basically what it means, it has 3 different levels. The FOSA, which is called Formation Sanitaire, district level, and national level. So most basic, actually most important things, they happen at the FOSA level, which is a lower level. So what they do, they have access to DHIS2 because they've been trained and they have the skills. They can do data entry, population data, resource data, vaccines, logistics, budget, everything that they were doing on papers, everything they were doing on Excels, they can now do it in the DHIS2 tracker. So they finalize that year's microplan, and later, if it's completed on the district level, as you can see on the second row, if it's completed, now they have aggregate data, and from the aggregate data, they can generate dashboards and different reports. Now we have microplan ready for execution. Same on the national level. It's the same, pretty much the same thing, but on the higher level, on national level. We have aggregate data also. They have access to dashboards. They have access to maps and visualizations. They can print and actually go with anywhere they go. So I realize I have 13 minutes, so I think this will give you a view of what we're able to achieve. So this is a screenshot from the Microplan tool. Here on the first view, we have the population view, the regular traditional view of the darker area, which has more people, and the yellow area, which has less people. But you can realize there are some catchment areas with missing data. But even though we have missing data, we have population data from WorldPop data filling in. So we can actually see there's like a number of people living up north. That gave us actually a very good insight, because even though we didn't have population data there, probably some missing data, but we were able to see that there's a lot of people living there, which is between Chad, Central Africa, and Sudan. And people realized actually there are refugees, a lot of refugees living there, and they need to be accounted for. That was the best result from this tool, and integrating the system with other tools. And from there, they can actually use the tool to generate, to plan outreach, different outreaches. Using the tool, you can plan, actually suggest new outreach sites and be able to calculate distance between them. There's a better view on the next slides. On the right, you can see, you can actually put different layers on top of a catchment area. You have those outreach, the strategy, the circle in the middle, and the people outside, you can plan how you will reach them. I think you'll be able to see on the lower, there's walk and drive. So you can actually calculate the distance from one point to another if you are walking or driving. which was really game-changing there in Central Africa Republic. A lot of rivers, a lot of um, lakes, and a lot of rivers, not many lakes actually. And you might think from going from point A to point B, it's going to take like 3 minutes. But someone is going to walk for 3 minutes, take a donkey for 15 minutes, take a motorcycle for, I don't know, 20 minutes. So when you use the tool, actually, I'll be around after the session. I'll be able to show you. It can calculate for you how much time it's going to use. And yeah, what were the results? We had good results where we achieved the in digitalization of microplan. Okay, I got it. So as I think I've talked about this, where we centralized 76 microplan. We had interactive maps. We trained staff at 15 central level and actually 21 at regional levels. Also, we had a signal where we saw something that we were not able to see before. Where they reported Penta-3, the coverage from like the difference between 2024 and 2025, there was like a jump where there was a 50+ percentage point. And I will not read everything. There's a note there you can read where there is it was because of the because of the denominator in absolute, which caused the underestimated values. So here I'm winding up to talk about the people and equity. What I was saying about the training of the people. So we trained 36 agents in total, and on the central and both on the regional level. And we made sure we include women and to make sure that all gender are trained. What does this teach us in the use of DHIS2? So DHIS2 should be like everything we do should be integrated in the actual the existing HMIS and DHIS2 that the country has. We should avoid parallel tools, using parallel tools. The country has already DHIS2. All in this conference, we have seen that DHIS2 has been a success all over the world. So use DHIS2. It's already there. People know how to use it. And make geography actionable, as you were saying, like assess the geography of the country and know how you can help people using the tools you have. So there's a lot. You should pair the configuration with capacity, design for equity actually from the start, know what's not going well, and help train everyone there. So yeah, if you see like above 100% like we did, note it as signal. So these are the next step where we are going to enhance the tool. Actually, we have planned talks with the people from World Pop, where we plan to sit together and look at the data from the World Pop, how we are calculating them and actually get insights from them. And we actually plan to add other important things like performance monitoring. We are trying to help people. It looks like that, right? We are planning to help people monitor what was the performance, because during Microplan, they plan sessions and they plan to visit and meet village leaders, meet community leaders, religious leaders. We are planning to help them monitor the performance of every activity and session they have planned. So, and we also have to improve microplanning process, as you can read from there, and deploy in the tool in the remaining district. So, this is the scale-up pathway. You can read from here, and actually the slides are shared. Before I go, I would like to give special thanks to our funders, national partners, and the platform, which is DHIS2, especially the Gates Foundation that are here actually in the audience, the Gavi, the Ministry of Health, International Medical Corps, DHIS2, University of Ohio, and HISP Rwanda. Thank you.